And for more of this, we're joined by the Vice-Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. A very good evening to you, Dr. Mzukwa. Thank you so much for speaking to us. Perhaps let's just first start with where you stand on this current protest action, industrial action by Nehawu and its affiliates. There are those who've been critical of it, saying that it puts patients' lives in danger. We've seen the Labour Department also, their outcry against it. Where does SAMA stand?
Good evening to you and to your viewers, SABC. I know it's been a while. The last time we spoke, I was the Vice Chair. Now I'm the Chairperson of the South African Medical Association.
We're glad there's growth.
No, regarding the question that you're asking now, we really sympathize and honestly feel that, the strike of this nature, is fitting for the healthcare sector and the public sector workers. Because, government has not been honest in terms of the bargaining council and everything that they've done. They have not been honest with the agreements and never honored the agreements that were made in that bargaining chamber. So a strike was inevitable. But what we do not agree with, is the manner in which strikers are conducting themselves or protesters are conducting themselves. It cannot be justified, that people are blocking entrance, intimidating those that are getting in hospitals to assist vulnerable and very sick patients. No matter what the frustration is, you cannot take it out to patients who are vulnerable. You know your politicians who you should be taking this fight to. You know where the office of the minister is. You know where the office of the president is. Must not be scared of those politicians and take it out to the vulnerable patients in the hospitals who have nothing to do with the frustration.
There's a reason I asked you that question. Some may have thought my being facetious, but you would recall in the past there have been times when you as SAMA and Nehawu have been at odds, specifically around the occupation-specific dispensation negotiations or bargaining. So principally you behind Nehawu and its affiliates around the demands that they're making. That's what you're saying. You just are decrying the conduct.
That's correct, Tsepiso. You will recall when we had a similar occurrence that was led by SAMA at around 2009, we made sure that there is skeleton staff that is in the hospitals and there is no intimidation of those that are helping patients. There is no time when there was no one who's looking after patients, especially the urgent emergency cases. So that is why we're saying we do not understand how, if you are protesting against government, then you take your frustrations out to patients.
But where does it begin and where does it end? Nehawu denying that they are intimidating those who are still going to work. Then there was the death of a 2-year-old child at Telile Mwerani Regional Hospital in Vosloorus, and we just heard there from the health department that at this point they cannot say that any deaths that have occurred during the strike can be directly linked to the strike action. So workers believe, as much as they are seen as essential workers, they say they are not responsible for patients' lives. Explain this to me.
Well, I don't know how the understanding of some in the healthcare sector, they characterize their presence in that space. But what I do know is that we are an essential health service, and we do obviously have to take note of the fact that if patients don't get our services, they will die. Hence, we do not have, doctors, for example, are not allowed to strike. They can have their protests and stuff like that, but they cannot really leave patients, to die out of themselves. So hence we are saying in this case, we do understand the frustration, and we like you said in your introduction, we've always been advocating for a proper remuneration of doctors and healthcare workers in the workplace. But we do not want to see patients dying because the employer is not taking care of the employers. It can't be the responsibility of the employer alone, especially if we are doing this in the workplace. If we are stopping ambulances, we're stopping patients from receiving care, it cannot be justified. But we are also worried about the response of government as well. We can actually see, everybody can see that we are led by cowards, who cannot stop Nehawu and those guys who are stopping patients from receiving care. The police minister is a coward. The minister of health is a coward. The president himself is a coward.
And just to add to that, we saw reports of striking KwaZulu-Natal nurses attack an ambulance trying to pull a critical child outside of the hospital. There have been those who've been stuck in ICU without anybody to look after for them, and people whose surgeries have had to be cancelled, and some of them are not. They are actually emergency operations. So what would you say to government to bring them to the table? Because Nehawu and its affiliates are saying, we want a 10% increase, a 2.5% housing allowance, bursary scheme for our children of our members. And they justify this by saying the cost of living is increasing dramatically. The inflationary pressure is unbearable. And it's, let alone transport costs, etc. So there is a deadlock. What would you advise versus them?
Well, first of all, I think they should have those negotiations. The workers, like I said initially, they have genuine concerns. But now the problem is that, like you said, we've got emergency procedures that must be carried on. We suggest, that the health ministry must talk to the Defense Department to send out those soldiers who are trained in healthcare to assist in the delivery of patients in the hospitals. Those that can assist in the operations must go there and assist, with the emergencies. Like it always happened. We always have the soldiers who are trained in healthcare who must take the space now. Because if we allow this to go on, I know there's this challenge that is facing the healthcare workers and government, the employer. But what do we do about the patient? We really need to zoom in and make sure that the patient is not affected, in as much as we demand what we demand, but also let's not hurt the vulnerable. So hence I'm saying there must be a plan, and the plan is send the military there to assist, in the surgeries, in the emergency operations, so that patients don't die unnecessarily.
All right. Thank you so much for speaking to us and sharing your views, Dr. Mvuyisi Mzukwa, who is the Vice-Chairperson of the South African Medical Association.